So Millikin is giving me, everything. It's not just how to do the job, but it's how to be an impactful leader in the community. And so I love that Millikin has given me that experience. I didn't expect it, but I believe I'll be a better provider once I graduate because of it. My name is Sheila Shamloo. I'm from Mount Zion, Illinois. I graduated from Millikin in 2021, and now I'm back in the graduate program, obtaining my degree as a doctor of nursing practice with a specialization as a registered nurse anesthetist. I heard a lot about Millikin's program. They have a great nursing program. I knew that before I ever started, and that was verified. Everything I heard about Millikin and how great the nursing program was, I felt that to be true during my experience there. I gained a lot of experience during that time with performance-based learning and getting my hands-on experience with the simulations and the mannequins. And then while I was finishing up at Millikin, I started in the intensive care unit at Decatur Memorial Hospital as a patient care tech. That was wonderful exposure also into making that transition from just an undergrad student to a registered nurse. Then once I graduated, I just went ahead and moved up roles from being a care tech to a registered nurse. Well, I enjoyed my experience in undergrad enough that I wanted to come back for something, and I always knew that I wanted to get some kind of graduate degree and continue on with my professional education. And so I'm learning a lot. I'm in my first year. I'm finishing my first year, learning about spinals and epidurals and placing those. We've learned a lot about everything that could be wrong with the patient, all their health issues and how that impacts our anesthesia for them, all the different types of surgery and our role, and not just our physical job, but as advanced practice nurses, we have a leadership role, whether we want to or not, to advocate for patients and advocate for better health for the community and the population, and being involved in political reform for those things. And so I'm learning about everything that makes you a well-rounded practitioner. One of the fun things about staying local in the community and working at the local hospital is that I worked with a lot of people and that have gone through Millikin and that are going back to Millikin. And so I want to push people, and I want to push them to go back and to do more, because I know they're capable of it, especially if they came from Millikin. I know that they would perform and do well coming back. And so when I was choosing what I wanted to do when I grow up, of course, I was always drawn to healthcare, and not just in the sense that I want to help people or, nurse them back to health, but the sense that there's such a gap between providers and healthcare and patients. And I feel like we can do so much more to educate patients and to empower them and to help them help themselves and be proactive in their health, because a lot of people think that they should only come and be involved in healthcare when something is wrong. But I love educating people and telling them, hey, this is what you can do before. And as much as I enjoy seeing you in the hospital, I don't want to see you here, And so, you should take care of yourself and do these things. And so being in healthcare and choosing nursing, we do a ton of educating. And I did a lot of that in the ICU, especially when, doctors are in and out and they don't have the time. Nurses, at the end of the day, we're the ones spending the time doing those things. And I have a passion for that. And so going into graduate school, I'm learning more so I can educate even more and do more things in that sense.